And then transverse humerus ligament is gonna be something that covering on the top of the long head of the biceps tendon, right? So when you find the biceps tendon, it's gonna be easier for you to actually find. You're gonna not popping like too down here. It's gonna be higher up here. So then when you feel the tendon, actually that's where the transverse humeral ligament is, right? This one. And then there is a coracohumeral ligament. It's on the top of the superior part of the humeral head. So and then it comes from the root of the coracoid process, and that one is not really palpable, right? But you're gonna go to the acromion process, and then like there's a coracoid process here at the bottom, and then you're gonna just try to palpate on the top of the humeral head, like that way. But sometimes like acromion process is on the top of it, so you cannot really feel the ligament much, right? And then what else? The glenohumeral ligament is just the joint capsule between the glenoid fossa and then the humeral head, and then it's on the top of it, like that way, anterior side of it. So you cannot really feel it because there's a lot of structure on the top of it, but you can go close by. So you need to feel their humeral head first, right? And then you're gonna try to go in between the space at the GH joint, and that's the ligament, right? And you cannot feel the superior part of that ligament because of the acromion, right? So you're gonna try to feel like all the way at the joint. So you need to go to the medial to the head, but lateral to the coracoid process in between the joints, right? So you're gonna feel that one. What else? Oh. And if you feel like you need to perform the friction on the supraspinatus tendon, so then the best position to put your patient into is gonna be the sideline. Okay? So can I get to the sideline away from you? And then your patient's shoulder has to come to the posterior part of their body. Why? Because when you have your patient's body at the side, the supraspinatus muscle coming from the fossa, and it's go underneath of the acromion, and it's attached onto the superior facet of the greater tubercle, right? And usually the acromion, the TP point, is kind of covering the spot where you're attached onto. So in this position, you cannot really get into the tendon of the supraspinatus muscle. So by rotating their arm medially, putting their arm onto the back side of it, the tendon is slide more anteriorly now, and then you can find the tendon. Like you're gonna go to the acromion process, anterior portion of it. Then the tendon you can feel is like here, like this way. So it's better for you to distract their arm a little bit and then perform the friction on the top of it. So because the tendon was from here to now, it's like this direction. So adhesion, like across, if you want to do the cross fiber friction, so then your direction is gonna be like this way now, right? And it's palpable for most of the female, but if like Ethan, no, I don't think so, because his muscle is too strong, so we cannot really pull it out from it and then do this one, right? You can pretend it, but sometimes you cannot really feel it.